Yeah, the radiograph, doctor. Did you bring me the CT scan? Awesome, yeah. I'm just getting the program up now. Here they are. Notice how they're all different. With the radiograph, it showed the aneurysm, but wasn't distinct compared to the CT scan.
AAAs occur when there is a weakening of all of the layers of an artery's wall. The outermost layer is the tunica externa, followed by the tunica media, tunica intima, and basement membrane. It is classified as an aneurysm when it becomes 1.5 times larger than its normal diameter. The most common type of AAAs are true aneurysms, which have two types, fusiform and saccular. The abdominal aorta is a continuation of the descending thoracic aorta. It goes through the abdominal region and has many branching arteries. It then terminates when the aorta branches into the left and right common iliac arteries. AAAs can occur anywhere along the abdominal aorta.
Abdominal aortic aneurysms are often asymptomatic. However, significantly large aneurysms can be accompanied by abdominal and back pain. The identified risk factors of this pathology are gender, body size, age, elevated cholesterol, and blood pressure, with overweight males over the age of 65 having an increased chance of abdominal aortic aneurysm development.
Observing the true fusiform aortic aneurysm via contrast CTA, it can be distinguished that the radiopaque pathology is a dilation of the abdominal aorta. The enlarged semi-radiopaque structures surrounding the aneurysm can be identified as the three layers of tunica: intima, media, and adventitia. Due to their soft tissue composition, they are shown as one integrated structure. Along the length of the abdominal aorta, radiopaque calcification specks can also be identified.
The location of the aneurysm can be specified by locating surrounding structures. Inferior to the aneurysm, the abdominal aorta terminally divides at the fourth lumbar spine into the left and the right common iliac arteries, which further then bifurcate into the internal and external iliac arteries. Superior to the aneurysm at L1, the renal arteries supply the kidneys. Through an axial CT visualization, the kidneys can also be located laterally, the small intestines anterolaterally, and the spinous process posteriorly.
These two MRIs show the abdominal aorta. The image on the left depicts a healthy patient. This can be seen as there is clearly no aortic aneurysm along the length of the vessel. However, in the image on the right, an aneurysm can obviously be seen just superior to the right and left common iliac arteries. The difference between these two images is quite clear.
So doctor, we have radiographs, MRIs, and CTs. Which ones are the best to view an aortic aneurysm? With a computed tomography angiogram, also known as a CT.
In radiographs, specifically abdominal scans, high-density structures such as bone tissue are the focal point. In this modality, blood vessels and consequently aortic aneurysms appear as semi-radiopaque structures due to their lower density. Radiographs are the least preferred modality for visualizing an aortic aneurysm due to the high amounts of superimposition. In comparison, a magnetic resonance image can clearly view soft tissues such as blood vessels. A contrast can be used to differentiate blood vessels from other structures, as depicted in this image. Furthermore, MRI do not use radiation. However, due to the restricted use towards patients with metal implants and its relatively high cost, it is not the best modality. Computed tomography images are considered the gold standard for imaging an aortic aneurysm. This is due to the low cost and accurate identification of the size and shape of the aneurysm, as well as other factors. However, a limitation of this method is the high levels of radiation that it exposes the patient to.
When discussing the misdiagnosis involved with abdominal aortic aneurysms, there are often two explanations as to why medical professionals can view AAA as something other than what it is. Firstly, the modalities of this condition are often mistaken with alternative conditions. This is due to symptoms such as abdominal pain, shock, and back pain mimicking an AAA. This clinical mistake often occurs due to the subtle appearance of an AAA during an abdominal radiograph. In addition, a large portion of the abdominal aorta may not be visible. Therefore, the use of a CT scan can determine the presence and whether or not the AAA is leaking or has ruptured.